This patient was referred to me for endodontic treatment of tooth number 2. As you can see, large periapical lucency here. And this patient has symptoms, so we call this chronic apical periodontitis with symptoms. You can see a large composite restoration encroached onto the pulp, caused pulpal necrosis and subsequent infection that you see here and symptoms. So today, we went ahead and started and completed endodontic treatment in one appointment. Again, we can do these root canals in one appointment as long as you can get the canals dry. And the way you know the canals are dry is right at the end, you take a sterile paper point or multiple sterile paper points to your working length, you remove them, you inspect the tip of them to make sure that they're not wet. If they're wet, they try a couple of times, still wet, calcium hydroxide, and bring the patient back. Otherwise, if multiple paper points taken to working length, sterile paper points taken to working length, come back dry, then you can obturate, regardless of the periapical diagnosis and pulpal diagnosis, and also regardless of whether there's swelling, regardless of whether there's a sinus tract, fistula, what have you. So, as I said, today went ahead and started and completed endodontic treatment in one appointment, and take a look. And here's the post-op. Here's one angulation, and you can see the conservative endoaxis. This is one angulation, the beautiful lateral right there. This tooth has 3 canals. There was no MB2, so I work under a surgical operating microscope and always confirm though. So MB canal, distal buccal canal, palatal canal. The MB canal and distal buccal joint, very interesting anatomy. And of course you can see the palatal. You can see that beautiful S-shape curvature there. So take a look at a different angulation. I'm going to show you a different angulation now. This is another angulation. As you can see, everything beautifully. Look at all of this anatomy here in the apical area. And all of that anastomosis between the mesial buccal and distal buccal canals. Everything went great. We went ahead and temporized the tooth and referred the patient back